Hey guys, it's Medicosis Perfectionalis one more time, continuing our playlist called Pulmonology. In the previous video, we have talked about silicosis, berylliosis, and cold worker pneumoconiosis. Today, we'll talk about the horrible asbestosis. By the way, there is a difference between asbestos exposure, big circle, and asbestosis, small circle, because asbestosis just means there is pulmonary fibrosis, which is a restrictive lung disease. Asbestos exposure includes many diseases, including asbestosis, primary lung cancer, mesothelioma, and even benign pleural plaques with some pleural effusion. As you know, we divide lung disease into obstructive and restrictive. Restrictive lung disease are divided into extrinsic and intrinsic. Then intrinsic lung diseases are divided into diffuse parenchymal and non-interstitial, such as alveolar. Diffuse parenchymal lung disease include three main categories: occupational and environmental, idiopathic interstitial pneumonia, and others. We're talking about occupational and environmental. We've talked about hypersensitivity pneumonitis before, byssinosis before, and today we're talking about asbestosis, which is inorganic dust-induced interstitial lung disease, which is part of the occupational and environmental interstitial lung disease, which is part of the diffuse parenchymal lung disease, which is part of the intrinsic restrictive lung disease. Boom! For those of you who are very sophisticated in chemistry, there are some geometric forms of asbestos fibers. We have four, even more of them: serpentine, amphibole, amosite, and anthophyllite. Serpentine, curly and flexible. They cause interstitial pulmonary fibrosis and lung cancer, and they are crystallites, is one of the main examples. On the other hand, we have the amphibole, straight and rigid fibers. They cause interstitial pulmonary fibrosis, also known as asbestosis, lung cancer, and mesothelioma, and these are called the crocidolite. Who named these things? And I thought that the pharmacological names of drugs were bad. Not so fast. There is a big difference between asbestosis and asbestos exposure. Again, asbestos exposure is the big circle, and asbestosis is just one small circle. Asbestosis means diffuse pulmonary fibrosis caused by asbestos exposure. But asbestos exposure, the big picture, includes benign pleural plaques, diffuse pulmonary fibrosis, which is the same thing as asbestosis. We have also primary bronchogenic carcinoma and malignant mesothelioma in the pleura. By the way, with the benign pleural plaques, we can see pleural effusion. Is it gonna be an exudate or a transudate? And the answer is, it's an exudate. It's an acute inflammation, darling. It has nothing to do with the Starling forces. Where is the asbestos? What are the occupations that are exposed to asbestos? First, we're gonna produce the stinking thing, asbestos. So, mines, mills, and factories. So, miners, millers, and manufacturers are exposed to asbestos big time, especially historically, because now they ban it, so it's very unlikely to see a 21-year-old today with asbestosis. But if he's like 91 and he was working in the mills or in the mines of asbestos, yes, it's very, very likely that he will get one of the four diseases of asbestosis, which are benign pleural plaques with pleural effusion, interstitial pulmonary fibrosis, also known as asbestosis, primary lung cancer, or mesothelioma. When you are exposed to a significant amount of asbestos and you smoke cigarettes, you have a very, very high risk of primary lung cancer. So this was just the extraction or the synthesis of the thing. Everything else is uses. So we use it in chemical and electric insulation. Construction workers, pipe fitters, boiler makers. Wow. Ships, especially old naval ships. I am a 93-year-old war veteran. I was part of the British Navy during World War II, which, as they call it in Britain, the Second World War. So America and Britain disagree on everything, including how they call the war. America called it World War II, and the UK call it the Second World War. So ship builders and shipyard workers. What else? Cement and floor tiles, roofing materials. So roofers, handymans, demolition of buildings, because those old buildings contained insulation material. They insulated the wires with asbestos. When they demolished the old buildings, all the workers were exposed to asbestos. And fast forward 30 years later, you'll see some oncologists, some doctors on TV, they are having ads, "We treat mesothelioma." This is not a conspiracy theory. These are just people who are good marketers. They know that when people are exposed to asbestos, Just give it 30 to 40 years and many of them will have mesothelioma. Same thing happened in Egypt, but here we're talking about hepatitis C virus. We saw a lot of hepatitis C virus, so doctors expected correctly. Just give it 20 to 30 years and you will have an epidemic of hepatocellular carcinoma, and they were absolutely right. Where are the asbestos fibers deposited? In the respiratory zone. What do you mean? Respiratory bronchioles, alveolar duct, and alveoli. Appearance in tissue called asbestos bodies or ferruginous body. If you remember the word ferrous and ferric, it means iron, baby. So these are made of irons. And by the way, they look like a dumbbell, which is kind of a fancy mnemonic how I think about it. What are these ferruginous bodies? They are asbestos fibers coated by protein and ferritin. That's why we call them ferruginous body. So let's say this is the asbestos fibers. All right, they are coated by what? By ferritin and iron. So they look like a dumbbell. Who coated the asbestos fibers? The alveolar macrophage or the lung macrophage. Who made the ferritin? Macrophages. Where are the ferruginous bodies found? You'll find it in the small airways. You have to obtain a bronchoalveolar lavage to see it, and or sputum if the patient is coughing sputum. This sputum can contain those ferruginous bodies. What stain will you use to detect them? It's called the Prussian blue because they contain iron. Like, think, people. How do these ferruginous bodies appear? They are golden brown because, you know, iron and hemosiderin, it has the brown color. Fusiform beaded rods, and they look like a dumbbell. Very famous exam question. Asbestos-related diseases. Number 1, benign pleural plaques. You might find pleural effusion with them. They are the most common lesion associated with asbestos exposure. They are asymptomatic mostly, calcified plaques of the pleura and the dome of the diaphragm. Benign pleural plaques increase your risk of pleural effusion, remember I've told you, but they do not increase your risk of mesothelioma, which is a pleural cancer. So, here we have a patient has been exposed to asbestos. What's the most common pathology or lesion associated with asbestos exposure? Don't say lung cancer, don't say mesothelioma, just try to be more subtle. The most common lesion associated with asbestos exposure is benign pleural plaques. Does this increase my risk of pleural effusion? Yes. Does this increase my risk of mesothelioma? No. But asbestos exposure increases your risk of mesothelioma, but it's not from the plaques. Translation: whether we leave you with the plaques or we remove the plaques, this is not gonna make a dent in your risk of developing mesothelioma later on. On radiology, these are ivory white, calcified, supradiaphragmatic and pleural plaques. Next, diffuse interstitial pulmonary fibrosis. This is the one that's called asbestosis. Again, do not confuse asbestosis, which is like this, and asbestos exposure, which is like this. So, asbestosis may have pleural effusion or may not. Lower lobes of the lung. Asbestos is used in roofing, so it's on the top, but it goes to the lower lungs. It's just a mnemonic. Compare that with silica. Silica is found in the sand, so it's down there. But when it goes to the lung, it's in the upper lobe. It's the mnemonic of opposites. Directly related to the intensity and duration of exposure to asbestos. The greater the exposure, the longer the duration of the exposure, the greater your risk of developing asbestosis, which is a pulmonary fibrosis with or without pleural effusion. Why? Due to reactive oxygen species. It's a restrictive lung disease, no kidding, it's parenchymal. Radiography, you will see small linear opacities, and this is asbestosis. Contrast that with silicosis or cold worker pneumoconiosis. The opacities were small and rounded, but in asbestosis, the fibers, man, remember the fibers. So asbestosis has linear opacities. There are 4 diseases associated with asbestos exposure. Number 1, benign pleural plaques. Number 2, asbestosis. Number 3, primary bronchogenic carcinoma. And number 4 is mesothelioma. Let's talk about primary bronchogenic carcinoma. Cigarette smoking plus asbestos exposure dramatically increases your risk of developing primary bronchogenic carcinoma. Actually, it is 60x. So, I'm a poor guy in my mid-20s. Okay, I have no family history of lung cancer. Touch on wood. My risk of developing lung cancer is less than 1%. Okay, let's say that another patient has been exposed to a significant amount of asbestos and he has been smoking cigarettes for 30 freaking years. His risk of developing lung cancer is 60%, which is 60x of me. Wow! This effect is called synergy. 1 plus 1 equals 3, which is a mathematical insanity but a pathological reality. Asbestos exposure, give it 20 years or so on average. This is called the latency period, and you have an increased risk of developing primary bronchogenic carcinoma. Does that mean that 100% of patients? No, nothing is 100%, but your risk of developing primary lung cancer is huge. Fourth disease is malignant mesothelioma. It's a pleural malignancy. Malignant tumor that encases and invades the subpleural lung tissue. So if this is the lung, the mesothelioma is like this. It's like a coat surrounding the lung, and it looks horrible if you look at it like on gross examination. Asbestos exposure. Here the latency period is not 20 years like in lung cancer, it's actually 25 to 40 years, and the patients will develop mesothelioma. Next, mesothelioma is not related to cigarette smoking. That's a very important point. Cigarette smoking is linked to primary lung cancer, but not to mesothelioma. I hate cigarettes, but I don't lie. Mesothelioma will lead to hemorrhagic pleural effusion and pleural thickening. Pathology. On gross examination, you'll find mass that encases and coats and invades the pleura and the subpleural lung tissue, like this. Microscopic, you'll see cancer arising from serosal cells. Oh, really? Because the pleura is a serosa. What are the 3 serosal layers? 3 P's. Pleura, peritoneum, pericardium. And you'll find psammoma bodies. What are other diseases that have psammoma bodies? Please let me know the answer down in the comments. And it is calretenin positive. Other complications of asbestos exposure. You get lung fibrosis leading to right heart is trying to pump against this fibrosed and thick and sick lung. Developing pulmonary artery hypertension. Developing right ventricular hypertrophy because the pulmonary artery exits from the right ventricle. This right ventricular hypertrophy eventually leads to right-sided heart failure, leading to jugular venous distension, ankle edema, and liver distension. Kaplan syndrome if the patient has rheumatoid arthritis plus rheumatoid nodules in the lungs plus complicated co-workers pneumoconiosis, and we have talked about Kaplan syndrome in the previous video. How to diagnose this horrible disease clinically? You need a history of asbestos exposure, so the occupations that I've mentioned before, sputum sample plus bronchoalveolar lavage to see the asbestos bodies, also known as ferruginous bodies that look like dumbbells. Radiology, high resolution CT is better than CT scan, is better than X-ray, but everything has pros and cons. High resolution CT scan contains tons of radiation exposure. Lungs, you'll see asbestosis, irregular or linear opacities in the lower lung fields. Very important. These opacities are linear. Contrast that with silicosis or cold worker pneumoconiosis. The opacities are round and small. Pleura. You'll find thickening or calcification along the parietal pleura, very close to the lower lung fields, and the ivory white calcification of the supradiaphragmatic and pleural plaques, and this is pathognomonic for asbestos exposure, especially the benign pleural plaques. Bronchoscopy with a biopsy to see the lung cancer or the mesothelioma. Pleural fluid analysis, you'll see serous or bloody exudate. It's a hemorrhagic effusion, also known as hemothorax. Pulmonary function test, you'll see a restrictive pattern because asbestosis is an interstitial parenchymal pulmonary fibrosis. DLCO is low because the problem is in the lung. AA gradient is high because the problem is in the lung. How to manage asbestos exposure? It depends. If you're talking about asbestosis or pleural problems, supportive care. Lung cancer, we'll discuss this in lung cancer. Mesothelioma is treated by surgery, radiation, and chemotherapy. Combination of cisplatin and something called pemetrexed. Who named these things? Prognosis? Poor prognosis with mesothelioma or lung cancer. The median survival rate of mesothelioma is 1 to 2 years. Quick review of the interstitial parenchymal pulmonary fibrosis. Hypersensitivity pneumonitis, farmer's lung, remember the moldy and thermophilic actinomycetes. Bird fancier's lung, chemical worker's lung, remember isocyanates. Miller's lung, remember the grain dust. Then we have organic dust induced, such as bisonosis, exposure to cotton. Then we have inorganic dust, silicosis, exposure to silica. Berylliosis due to exposure to beryllium. Brilliant people working at NASA. And not so brilliant people called dentists. Sorry, dentists. Everybody hates you. I'm just messing with you guys. coal workers' pneumoconiosis due to exposure to coal mines, and of course asbestosis due to exposure to asbestos. On your exam, it's either going to be a roofer or a shipyard worker or someone who works with insulators, and this is historically, so expect the patient to be older than 50. There is another disease that causes interstitial pulmonary fibrosis called menorrhosis. It's a restrictive lung disease, upper lobes of the lung, because again, the manure, the fertilizer, is in the soil, so it affects the upper lobes of the lung. Okay, why exposure to fertilizers or manure? Lungs are literally full of bleep. Pathology, gross examination, you see brown, black discoloration of the tissue. Microscopic, you'll see nitrogen particles filling the alveoli. Actually, the whole thing was a joke. There is no such thing in medicine as menorrhosis. I was messing with you. Now, some of you believed it. At least be honest and admit it in the comment section. This is April Fool's in September, which makes me weird. Some clinical pearls. Coal worker pneumoconiosis has no increased risk of tuberculosis. Silicosis increases your risk of tuberculosis and or lung cancer. Silicosis is the most common occupational disease in the whole freaking world. There's lots of sand and lots of rocks out there. So whenever you hear a politician or a scientist saying, "I will eradicate cancer," tell him that he is full of it. The mnemonic of the opposite. Asbestos is used in roofing, you'll see it in the lower lung lobe. Silica is used in sand, you will see it in the upper lung lobes. Risk factors for active TB, recent infection, fibrotic changes, tobacco smoking, malnutrition, and some comorbidities, including silicosis. Here is just a sample of the diseases that affect the upper lung fields. Coal worker pneumoconiosis does not involve the hilum. Silicosis does involve the hilum. Eggshell calcification of hilar lymph nodes. Sarcoidosis involves the hilum. You'll see bilateral hilar lymphadenopathy. Very important for your exam. What's in the lymph nodes in sarcoid patient? It's called non-caseating granuloma, thanks to the CD4 positive T helper lymphocytes, thanks to the epithelioid cells, also known as macrophages, laying around and forming this multinucleated Langerhans giant cell. Quick summary, asbestos-related lung disease. The most common pathology related to asbestos is not mesothelioma, is not lung cancer, it's actually benign pleural plaques with pleural effusion. The most common cancer related to asbestos exposure is not mesothelioma, it's primary bronchogenic carcinoma. What type of lung cancer? Usually adeno and small. So, okay, the most common cancer associated with asbestos is primary lung cancer. What is the second most common? And this is going to be mesothelioma. Remember, it's not related to cigarettes. Asbestos does not increase the risk of tuberculosis, but silicosis does. The most common lung cancer is secondary lung cancer. It's metastasis. It's not the primary lung cancer. Metastases are commoner in the lungs. Why? Because the lungs receive all of the blood, all of the circulation that's coming from the right side of the heart, called pulmonary artery or pulmonary circulation, ends up in the lung. No wonder why metastases are commoner than primary lung cancer, because every single stinking cancer coming from wherever in your body may end up in your lungs. Okay, if I see a metastasis in the lung, which means it came from something else, from somewhere else, where is the primary cancer? Usually it's breast cancer, if it's a female. If it's a male, it's primary colon cancer, and they all end up in the lung. So you can have a lady who developed breast cancer, was treated with chemo, radiation, and even radical mastectomy. Then 5 years later, she developed a metastatic breast cancer going to the lung, causing lung cancer. Horrible. The most common subtype of primary lung cancer is adeno. Mesothelioma, significant asbestos exposure, give it 25 to 40 years. Presents with pleuritic chest pain plus unilateral hemorrhagic pleural effusion, also known as unilateral hemothorax. Radiography taps. Coal workers pneumoconiosis or silicosis, you'll find small rounded opacities, but in asbestosis, small linear opacities. Hashtag remember the asbestos fibers. Now let me answer the questions of the last video. What's the most common pathology related to asbestos exposure? And the answer is benign pleural plaques. What is the most common cancer related to asbestos exposure? And the answer is primary lung cancer. What is the second most common cancer? It's gonna be mesothelioma. Remember, primary lung cancer is related to cigarette smoking. Mesothelioma is not. This was the most comprehensive discussion of asbestos exposure on the whole freaking planet, so please subscribe. Hit the bell to get notified, share the videos and smash like. Follow me on Facebook. I have more than 100 cases there. You can get my premium videos, my video notes, my post notes, my cases, my PDF notes, including the slides of this video and every other videos organized in nice Dropbox folders by going to patreon.com/medicosis. Thank you so much for watching. As always, be safe, stay happy, and study hard. Until next time.